Hello. Alex here again. Got another vlog for you about physical health and mental health. So, this vlog is all about drugs and alcohol, okay? And so, the link between the substances that we put in our body in relation to drugs and alcohol and the effects on our mood. Yep. So, there's some pretty common knowledge out there about particular types of substances and how they affect our mood. So, alcohol in particular, most people know alcohol is a depressant. And so it's super appealing to people who are experiencing anxiety because it works very well in the short term at relieving that anxiety, right? And so it makes sense that if you've got anxiety, maybe you're, anxious when you go out to social events or around other people, and alcohol sort of takes that edge off. However, we know that because it's a depressant, it's actually going to be making anxiety worse at the body and the brain level. So we want to be really careful about using alcohol to treat anxiety, and of course erring on the side of moderation. If you're suffering from anxiety, even social anxiety, think about getting some treatment for that so that you don't have to rely on alcohol to do that, right? And getting into some therapy or talking to your doctor about other options for treatment so that you don't have to rely on that drink all the time. Treat the underlying problem, which is the anxiety, right? Because the alcohol will tend to make the anxiety worse in the long run if we're using a lot of that. And obviously with depression, you're adding a depressant on top of depression. That tends to not go very well. But the other thing with alcohol that a lot of people don't realize is the disruption to sleep and the disruption to really good quality restful sleep. So our brain really needs good sleep. I spoke about this in another vlog. Our brain needs really good sleep for good mental health. If we're lacking quality in sleep, our stress levels are going to go up. We're going to have lots and lots of stress hormones pumping around our body, and we're going to feel run down, and we're headed to burnout, right? So sleep's really important. And when we ingest alcohol at certain quantities, it disrupts our sleep so that we miss out on REM sleep, right? So REM sleep is that rapid eye movement phase. It's where we tend to do dreaming, and it's where the brain gets to really kind of recharge. And so if we drink a lot of alcohol, we don't get that REM sleep, or it's not as good. And that's why you wake up feeling really tired. If you've had a big night, you might have slept for hours, but you're exhausted, right? You need an afternoon nap, you feel sluggish. That's because the quality of sleep's been really poor. So, just paying attention to how you feel after you've been drinking, the next day, but even like 1 or 2 days afterwards. Maybe keeping a bit of a mood diary, just really noticing what's going on and how alcohol affects you, because we're all a little bit different, right? We all metabolize things a little bit differently. So just get really aware of how it affects you, and then you can make some good decisions about when you drink, how much you drink, and how you want to manage that. So marijuana, pot, THC is something that a lot of clients of mine use. They find it helps them feel relaxed. They like the effects of that. We do know that the effects of THC on the brain are not great. I know there's a lot of stuff around cannabis oil for mental health, and look, the research around that, in my opinion, is still lacking. I think that we need more information about the long-term effects. I'm not an expert on that, but what I do know is that people who smoke a lot of pot, it can affect their brain in ways that are sometimes not so great in the long term, right? So just be careful with that stuff. Be careful where you're getting information in regards to the benefits of THC for mental health. There's way more evidence to show the detrimental effects. We know that THC is very problematic for people who have any predisposition to psychosis. So if that runs in your family, or you've ever had an episode of psychosis, which is, hallucinations, delusions, things like that, you really want to stay away from pot. It's one of the worst things for those sorts of conditions, and can really bring on some pretty scary episodes for people. So drug-induced psychosis and things like that. With pot, also, hallucinogenics, LSD, things like that. So, be careful where you're getting your information from. And, there's a big difference between, a regulated, legalized product and just smoking pot that you get off your dealer, right? They're not the same thing, and they're not going to have the same effect. So just be mindful of that. Again, keep a mood journal and notice how your mood, changes, or how your mood is affected after you smoke, right? And not just like the day of, the day after, but maybe the whole week, right? So just paying attention to that, and how you feel at times when maybe you're not smoking, right? So that you can make decisions for yourself around that. So when we're thinking about drugs and alcohol, also, thinking about prescription medications, right? So prescription medications can affect our mood drastically, particularly if you're taking psychiatric medications like antidepressants, things like that, mood stabilizers. So it's really important with those medications that you take them as prescribed, right? Most people know with antidepressants that it's a really bad idea to stop taking them suddenly. It can actually be really dangerous, right? So it can have physical effects, but it can also trigger this sort of rebound depression that's really, really problematic for people. So these are medications, the SSRIs and the SSNIs, they take time to build up in our system, right? So 4 to 6 weeks to reach a therapeutic level. And then, if we want to stop taking them, we need to step it down gradually with your doctor's supervision, okay? And we want to do that really nice and slowly, and just watch out for, things that might be coming up. So don't stop taking them suddenly. Don't, muck around with them and like miss a couple of days and then take more. Like, they don't work that way, right? So don't do that. It's really bad for your brain. The brain doesn't like it. And the medication is not going to work very well if we're mucking around with it. So if you have trouble remembering to take your medication, set an alarm on your phone. Keep it next to your bed. Keep one packet in your bag and one packet in your car or at home, or, make it a priority, right? Super important, because if we are not taking that medication as prescribed, it's going to have a really big impact on our mood and our mental health. And people can have problems where if they've been, on and off mucking around with antidepressants, they find that they just, even when they start taking them properly, they just don't work as well. So if you've got questions about that, ask your doctor. But, just take them as prescribed. If you've got concerns about side effects, go and talk to your doctor. Don't just stop taking them suddenly, okay? Other things to think about, so other substances like caffeine, right? So caffeine with anxiety can really make anxiety worse for a lot of people. I know people love their coffee and their colas and all that sort of stuff. Tea actually has, heaps of caffeine in it too. Just be careful, again, keep a bit of a mood diary and notice how caffeine affects you. Notice if it causes anxiety to go up for you. Notice how you feel if you have a day where you don't drink so much coffee, right? Maybe think about decaf options. A lot of people I work with like green tea, but green tea can have huge amounts of caffeine in it. So get a decaffeinated green tea option if you want to do that. So, substances have a big impact on our mood, and we just want to really do some investigating and figure out how they affect us individually, right? And then you can, make some decisions for yourself so that your mood and your mental health feel really nice and stable. All right, so I hope that's been helpful for you guys. I'll see you later. Bye.